Welcome back. We spoke to vascular surgeon Dr. Jeffrey Apple with VeinSolutions about a new treatment that uses medical glue to fix varicose veins for good. Take a look.
A lot of people are just cursed with these just from family history. Varicose veins are caused by several things. One is people with occupations where they have prolonged standing. A strong family history is also very common. Mom or dad had these. And then pregnancy is probably the biggest one. First thing we usually do is just educate patients on what varicose veins are, kind of reassure them that they're not dangerous and that it's kind of a slow, progressive process. I do tell people it's not an emergency. These aren't usually urgent, that they slowly just get worse over time. Occasionally we'll have people who will get small blood clots in branches of the varicose veins. Those aren't dangerous, but they're kind of painful. They may discolor their leg. It's more the long term that we're thinking about. There's several different treatment options. When people have tried everything they can, they take a period of rest and elevating their legs and use compression sawing. We also encourage people to keep their weight down. Weight and prolonged standing are kind of a bad combination. So if you do those three things, you can bear with these for a long time. And usually the thing that'll bring people in is pain. If the pain in their legs is too bad, or the swelling, what we call leg fatigue, where it's just a tired, achy leg. If it gets to the point where they're complaining to their spouse or significant other, they'll usually come see us, and that's a good time. The first thing we do is we'll start with an ultrasound, and we'll kind of map out where the problem is in their veins. And usually what we're looking for is valvular damage in the veins, and it's a pretty simple test. It takes about 20 minutes to do. Many years ago, we used to strip or actually remove these veins. And now we have techniques where we actually close the bad veins and just eliminate the flow through that, thus making the patients feel a lot better. So VenaSeal is a fairly new treatment. It's been around for about 5 years. We actually use a medical glue called cyanoacrylate. It's very gentle. We don't have to use hardly any local anesthetic. Patients like it just because there's hardly any pain involved. Once they're done with the procedure, they can just kind of walk out of the room and go about their business for the day. There's a few cosmetic procedures that we do that are not covered by insurance, but most of the major venous work we do is covered by insurance. You know, the treatment for varicose veins is very simple this day and age. Most of the treatments that we do are very safe and very easy. We do them in the office. We just have to pick the right people to do the procedures on, and those patients usually do great every time. It's nice to treat people who need it. It's very safe, and they're very happy usually when they come back to see us.
You can find out more online or give them a call at the number on your screen.